Well, it's good to be open to your colleague, your spouse, your friends. Do not hide anything to each other and ensure that things get better in your relationship. And away from that particular one, let's talk maternal health at this time, which is a critical aspect of reproductive health and encompasses the health and well-being of women during pregnancy, childbirth, and postpartum period. Now, this involves access to quality health services, including prenatal care, now skilled birth and attendance. The postpartum care is already at the moment ensuring that the health development in Nigeria gets better to avoid death of pregnant women in the country. Now, despite progress in involving improving maternal health outcomes, many challenges persist. The maternal mortality remains a significant concern, with many women worldwide dying from pregnancy-related complications in the country. Now, joining us for this conversation is the Executive Director, AC, Rhoda Robinson. Good morning. Thanks so much for joining us on the program this morning.
Good morning.
The figures are alarming about the rate of pregnant women dying. The World Health Organization puts it about 300,000 women die annually concerning pregnancy complications. What do you make of this development, and what interventions can be put in place to reduce these figures?
Okay, thank you so much. As you said, the rates of maternal mortality is really, really alarming, especially the fact that the causes of death, majority of the time, are entirely preventable. With adequate care, proper information and management, most women, if not all, should be able to have safe birthing experience and pregnancies. And this is what we're looking at today. Recently, the data from the National Demographic Health Survey showed that while we have been making a bit of progress towards reducing maternal mortality, over the last 3 to 5 years, comparing from 2021 to 2024, we have seen that there has been a slight increase in the number of deaths that we're looking at when it comes to mothers and their newborn babies. And this is usually within the birthing period and immediately after birth, because we have
postpartum.
That's the neonatal period. So within the first 1 month of a baby's birth, the first 1 year and the first 5 years, how do we ensure that we do not lose our women and their babies to complications or other issues relating to maternal mortality? And there are key factors and key challenges that contribute to the increase or the rise in maternal mortality ratio. For instance, Nigeria still has, in most states, below 50% of the health facility have skilled birth attendants. When you do not have skilled birth attendants, there's a higher possibility of you losing mothers to death. When you do not have enough equipped facilities that are able to handle cases like postpartum hemorrhage, or the health workers are not trained to handle cases of postpartum hemorrhage or immediate danger in infants' health, you'll find that you will lose more babies and mothers to death. So it's important that we invest in interventions that address these challenges. We invest in interventions that promote education and promote the uptake of antenatal care and postnatal care.
So we should be blaming all of this. You said Nigerian, we are yet to have better equipment, skilled workers. So who is responsible for all of this?
I think it's a shared responsibility, because we are all part of the same society. We all have our different parts to play in society. And we have states in Nigeria that their primary health facility, which is the first point of contact for most women during their pregnancy, have absolutely no skilled birth attendants. And when we are talking about skilled birth attendants, we are talking about nurses, we are talking about doctors, and we are talking about trained midwives. The most that they have is community health extension workers. And these are the people that are saddled with the responsibility of ensuring that they provide quality care. Now, you can imagine the quality of care that can be available in a primary health facility in a rural community where majority of our underserved women live in. Now, When you're looking at the case of postnatal care as well, you'll find that in most rural communities with women who have less than a primary or secondary school education, you see less than 25% of them actually get that immediate follow-up. Once they've given birth to their babies, that immediate follow-up that is needed within 48 hours to ensure that the mother is fine and the baby is fine. Less than 25% of them get them. When you compare that to in the more developed societies and centers.
Even in the developed society, I have a data here saying that according to EU, that 1 in 10 women do not have access to health services in their first month of pregnancy.
In Nigeria, we have up to 1 in 8 in 10.
In 10?
Yes. So you can imagine the scale of the problem that we are looking at. We are looking at affordability. We are looking at knowledge in itself, because we still have a lot of women that do not give birth in health facility. Sometimes it's not their own fault. Maybe the health facility is too far, or maybe the health facility, they cannot afford the care, or it doesn't run 24-hour services and they're going to labor at night. So these are all challenges that we need to address. And this is one of the work that we do at Hasty, because we recognize this gap. We cannot all fill the gap. The resources are not available to a lot of women. And so what we do is that we support this community health extension workers. We support the women. We provide training for them. We provide safe birthing kits to reduce the chance of complications and infections during pregnancy.
Are we also considering the issue of funding in all of this?
Yes.
The knowledge gap. You know, some of them wouldn't want to patronize the so-called good healthcare facilities, may not have good funds to be able to do this. Are you also considering this?
Yes, and that's part of the program that we are also running. So we have a program called Project Agbebi. And what this does is it combines access to maternal health care to supporting women to actually plan financially for becoming mothers. From the point at which they know they're pregnant, how do they manage their finances? What can they do? What savings can they get into? What affordable health insurance can they use to ensure that, during this period, if there's any event that, they might need a cesarean operation or they might need additional care, there's the funding and the support required for them to do this. And then after birth, a lot of times people forget that there's a period after birth where the mother also needs constant support, because for some women, the childbirthing experience is really traumatic. The changes that she goes through can be very, very unsettling. So we also provide mental health support, social support for these women so that they do not feel alone. If they have an issue, they're able to call someone and say, I'm having this issue. I don't know what's wrong with my baby. Can we do something about it? And then that community network that has been created around her is there to support her, to ensure that even in imminent danger, she's able to reach support.
Are you also aware that there are government initiatives put in place to ensure that women get quality healthcare services?
Yeah.
How many of them are aware about this?
A lot of them, and I must applaud the governments that we have right now. They are doing the most that they can with the limited resources that they can. Human resource is one of the major challenges that you find affecting our healthcare system. As I said before, there are states with no skilled healthcare providers. We have health facilities. Most of them are in secondary facilities or tertiary facilities. How many people can get there? So right now we're working with Ocean State to actually see, what can we do with the indices that you have? How can we support them? And you find that a lot of states are actually taking up the mantle to ensure that they are able to provide quality care that is affordable, whether it's in the case of ensuring that the moderately skilled healthcare workers that we have, that's the community health extension workers, that they're able to provide better support, or we're able to provide more information to the women so that they know that the importance of antenatal care, the importance of giving birth in a health facility, and the importance of the follow-up in case of the immunization that the children need to have after they have been born, to reduce preventable diseases and preventable deaths for mother and child.
There are some people who believe so much that going to quality healthcare service, going for quality healthcare services may not be the way out for them. Some use herbs to ensure that their delivery. What's your advice to them?
A lot of times, education is all someone needs. For instance, the statistics I gave you earlier, where 22% of women who have little or no education do not even have access to postnatal care, compared to up to 80% of women with post-secondary school and university education who have access to postnatal care. A lot of time, knowing what you need can actually change the way you behave. So a lot of advocacy, a lot of education, training is important when you're working with community women, when you're working with women of any caliber, because they need to know first, and they need to know the benefits and the challenges that are involved. Sometimes they just adopt things because that's what has been passed down from when there was no primary health facility in the community, and they had to depend on the traditional means. But if you have a functional health facility that is equipped and has skilled attendants and skilled healthcare providers within the facilities, you find that it is easier for women to actually go to these facilities and seek care and receive the care that they need.
Do you also advise women to also consider family planning? Because when you see some people, it seems it's a yearly thing of pregnancy. Apologies for that. So what's your role to advise them on family planning?
We've been working with a lot of partners, both states and development partners, in ensuring that we are able to reach our modern contraceptive prevalence rate. And a lot of health facilities actually incorporate family planning, education and awareness during ANC. And we contribute to that in ensuring that every single woman knows that she has that choice, is able to know the choices that fit her. There are some women that prefer the implants that are just 6 months implants. There are ones that prefer the longer term ones that are 2 to 5 years. There are others that they know they are done. So they just take the 10-year contraceptive. But pushing for the availability of these commodities is one thing, and then educating the women to understand, and their husbands, because a lot of times the husbands play a very key role in the decisions concerning family planning. So working with the husbands, working with the women to say that, okay, understand your family dynamics, understand your economic reality.
Okay.
That can you afford to have more children? If not, these are the options that you have for you. Understand that family planning is safe, and that what you are doing is ensuring that you are able to spread your resources and invest it properly in the children that you have. So we are not saying do not have children. We are saying that if you know how many children you want to have, and then space it so that you are able to better adapt to how the situation is changing, especially with the economy that we have right now, that everything changes on a daily basis. So know how to plan, and then these are the places where you can get that information, where you can get those commodities. A lot of primary health facilities offer family planning commodities and services. So we encourage them during ANC. We teach them about what those options are, where they can get it, and a lot of times it's very affordable and it's free.
So it's both the husband and wife?
Yes.
Are there contraceptives that even the husband can also take?
Condoms.
That would be a bit early to start talking about that on the early morning show. But there are sometimes you see some pregnancies, some would term it as miracle baby. Your advice to that woman watching you at the moment? What they should do?
Plan for your babies. You can't just wake up and say you want a baby if you do not have a job, you don't have a place to stay, you don't know how to feed yourself, and then you're bringing another child into this world. So plan properly. Ensure you know everything that is involved. Go to listen, attend health seminars. We run a lot of health seminars.
And you communicate to those people in their local languages?
Yes.
Because that is key.
That is important. It is the most basic thing that you can do. Talk to them, meet them where they are. Do not expect a woman who is a market woman selling pepper at the side of the road to come and meet you in Landmark Center that you want to do a health outreach. No, you go to the communities, and we've done this every single time because we know that is where they are.
It's a fine place to leave it. Executive Director, AC Rhoda Robinson. Thanks so much for joining us.
Thank you so much.
On the program this morning.